All right, good evening and welcome to week 6, musculoskeletal as well as the integumentary system. So for this week, you have a big video due. The musculoskeletal system is one of the longest, possibly most daunting video for some of you. Learning all the different joints and the tests that you can use to assess the joints and a test that you can use to assess the different ligaments as well will be a little intimidating as there are a lot to learn this week. So make sure you do plan ahead, ample time to study the material and to practice on your patient. Read the chapters 6 and 16 for skin and musculoskeletal. When you look at the skin chapter, one of the things I like to tell patients, and I'm going to go to Bates briefly, tell my students, is that there are many rashes that exist, and it's almost impossible to be able to diagnose all of them. But what is important to know as a nurse practitioner is to be able to at least identify the morphology of the lesion. So what I mean by that is the shape and the size and the specific name that the lesion is called. So you need to know what a bulla is versus a macule or a papule versus a fissure or versus a scale or versus an ulcer. And those descriptions and definitions are found in your Bates textbook. And so right here, you can look at describing skin findings, macules, patches, papules, and plaques, okay? So talking about raised versus flat. You need to notice the difference between primary and secondary lesions, okay? A primary lesion is the initial lesion. Secondary lesions are examples of things might be like chicken pox or impetigo, when there's a secondary lesion or crusting that happens after the primary lesion, okay? So these places in your text that are in blue, I always say to study those very well, especially for skin, being able to identify if the lesion is linear or annular, which is ring-like, right? Color, using skin-colored or flesh-colored to describe a lesion that's the same shade as the patient's skin. So take a look at your Bates, the pictures in Bates, and also the descriptions of the lesions, because in your boards and on your HESI, they don't have pictures. They'll describe the lesion. So you'll need to note those descriptions. So read all of these little descriptions in your textbook. And musculoskeletal, go through that rubric. Make sure that you know everything, how to do it. You start with inspection, then palpation, then range of motion, and then specialty tests. So that's the correct order. You do owe another SOAP note to your instructor this week. So again, it's the findings. You have to write out the findings, but it's going to be part of your bigger SOAP note with a complaint that is a musculoskeletal complaint that you would see in a primary care office. So not like a huge open compound fracture that should be in the ER, but something that you would see in a clinic, a community clinic that's for primary care. So I'm talking about low back pain is a really common one, all right? Another good one is an ankle pain or ankle sprain, neck pain or neck ache. It can be acute injury as long as it's something that normally wouldn't present to the ER right away. You also have a quiz this week covering musculoskeletal and skin, a sync session. Again, your full SOAP note with your musculoskeletal video. And you have two modules in shadow health, musculoskeletal and cough. So one big thing you have to do this week is schedule your HESI test. You might have already done it last week if the scheduling was open, but if not, go ahead and try to schedule this week. You don't want to have that additional stress to worry about in the following week right before your test. Additionally, make sure you click on the HESI details and read through and perform all the different tech checks, okay, that are a part of HESI, because you don't want your computer to be too slow or have the wrong computer. and make sure you're not using a Chromebook and not using an iPad. So addition to that resource is this HESI Student Quick Guide. Okay, it shows you pictures on how to access your dashboard, how to schedule your test. All right, so this is all in the different links in the course. So to get to that one, you had to open up this first link. When you open up this link, you get even more links. All right, so make sure you do that. The rubric for musculoskeletal is also here, and with all the other rubrics, you can open that, take a look, and study it. It's such a long exam that we had to give more points to the exam and fewer on the SOAP note. So I think it's like 75 for the exam and 25 for the SOAP note. Other than that, it's a pretty normal week. Everything else is coming up, though, in week 7 and 8 with your HESI, your head-to-toe physical, and your lab assignment. So make sure you plan accordingly. Thank you.